About 9 out of 10 people suffering a heart attack complain of chest pain or discomfort, the researchers said. But there are many other medical problems that can also cause chest pain in addition to heart attacks. The study, which was published in the journal JAMA Internal Medicine, contends that women are more likely to experience other common signs of heart attacks, including shortness of breath, nausea, vomiting, pain in the back, neck, or jaw. The findings recommend ER doctors run blood tests and EKGs to determine if a woman's chest pain is in fact related to a heart attack. During a recent seminar, Dr. Gary Allen, cardiothoracic surgeon at Florida Hospital Waterman's Heart Center, explains why it's important to know your medical history and what the latest treatment options are.
I think it's always powerful to have the members of our community informed about what different resources are available to them. I think the internet could be a wonderful tool, but sometimes it's very confusing. And I think every single patient, every single physician, it's incumbent on them to be responsible for their own medical needs. And because heart disease is still the #1 killer in North America, 70% of people who die from heart disease, I think it's always relevant in our healthcare, whether it's a family history, whether it's someone with known diagnosis, or somebody who's just trying to maintain wellness and needs to think about, what the next 5 or 20 years will look like for them. Today we're giving a talk to the community about the differences between ways we do bypass surgery for blocked arteries. There's 2 types of ways in general. One is traditionally where we use the heart-lung machine, which is a really elegant device which takes over the function of the heart and the lungs. And while it provides a really safe and bloodless field, it also has a lot of downside to it. More recently, there's been a set of technologies that allow us to operate on the heart while it's beating. And that's what we call beating heart surgery, or sometimes called off-pump surgery. So the heart and the lungs continue to function as they do in the natural state, and we use a system of what we call stabilizers, which allows us to stabilize the one small part of the heart where we're operating and allows the rest of the heart and the lungs to function normally. And we have found there's a huge amount of patient benefit to that insofar as shorter hospital stays, decreased bleeding, decreased problems with rhythm, easier to get the patients off of the breathing machine, and they tend to recover a lot more quickly. What's challenging out in the medical community is that not every program offers that, and probably only about 15% of operations like that get done in the way we would consider most contemporary. And the important thing, I think, is to identify institutions that focus on that. In other words, they don't just dabble in it, and make that part of the culture and what they do. And I think it's important for the members of our community to understand that that's a resource that's available to them here.
For more information about the cutting-edge procedures offered at Florida Hospital Waterman's Heart Center, click the Surgery Seminar story link icon on our homepage, yourhometownhealth.com.